about to do a dry needling technique for Serratus Posterior Inferior. So this is a muscle that often gets forgotten by us therapists. It's one that covers a reasonable amount of space in our lower back area. It's heavily involved with thoracolumbar rotation, stabilization through the lower back as well. When it gets very tight, we do tend to lose a lot of rotation in that space. It's also involved in respiration, so multifaceted kind of muscle, this one. Very important to maintain its healthy functioning. So this muscle extends off of the lower ribs and then comes down and attaches to the spinous processes of the lumbar spine. So on each side of the lower back, it kind of creates a V. And you can imagine how that would restrict rotation then when somebody tries to move through that thoracolumbar junction. So we're going to now take a closer look at how we would needle this muscle. Okay, so we're about to needle the Serratus Posterior Inferior. So as I said before, it runs on a diagonal from these posterior ribs, angling down towards the spinous processes in the lumbar spine, like a V on each side of the lower back. We're going to angle our needle with the direction of those fibres to make sure that we're angling down away from the lungs, for obvious reasons. Pneumothorax is our biggest risk factor with dry needling, and we want to make sure that we're staying away from the lung with the direction of the needle that we're applying. So make sure that before you apply the needle also that you get a really good sense and confidence with your palpation about how much tissue you've got to play with. Everybody has different amounts of body fat, and we need to make sure that we can confidently get down to the level of the muscle without compromising that lung. If you don't feel super confident about this because you don't have a really good sense of the depth of the tissue, I definitely recommend that you don't try this. Okay, so we're going to first of all clean that skin, make sure that we've followed our hygiene procedures. Needle size 40 to 50 millimeters in length is plenty. We're going to palpate down to that rib. We insert the needle following the angle of the fibers of that muscle. Insert that needle, making sure that we're staying superior or superficial to the level of those ribs, angling down into those muscle fibers. You're going to pass through a number of other different tissues here to get to Serratus Posterior Inferior. That's okay. We'll put a couple of needles in, pick up a couple of different fibres. Again, staying superficial to the ribs. We've got plenty of space to play with here, angling down and away from the lungs towards the lumbar spine. It's a fairly flat muscle, and once we've threaded the muscle in this way with the needles, we can actually use a winding technique to wrap that myofascial tissue around the needle and get a nice stretch. You can see a little twitch there from the muscle. We can wind up that tissue, and typically if that muscle's tight, the patient will respond by experiencing quite a bit of tension build up in that area, and it's a great way to get a little myofascial stretch in the tissue, but also possibly hit some trigger points in the process and decrease the tension on that Serratus Posterior Inferior.